Additional CEO NHA, Mr. Vikram Pagaria, Joint Director NHA, my friend and colleague, Mr. Randeep, who is the Commissioner of Health and Family Welfare, Government of Karnataka, and Mr. U. Ahmed, CAO of the NHA. And all the distinguished participants who have assembled here and also joined online. Like any other sector, in the health spectrum also, the technological innovations are taking place at a very rapid pace. We are getting lots of products, both in terms of the hardwares which are being available, as well as a lot of softwares which are getting created concerning the human health. This is making the fruits of technology available for the benefit of humankind in a very large manner. See, Karnataka, being the IT hub of the country, has undertaken from time to time a lot of experiments, and at various occasions it has led from the front in terms of developing and utilizing the digital technology for the health sector. I would like to say a few words how the scope of digital health has got enlarged. There are various reasons behind it. If we think of supply side, I'll cite some examples. Supply side, there is a great deficit. You all must be aware there is a shortage of starting from top super specialists, doctors, nurses, even the lower rung trained medical manpower at different levels. And now, going beyond the overall shortage, there is a great problem of distribution. We find all sorts of hands available in metros, big cities. As you go down the size of the towns and cities and villages, their availability gets decreased, and there is no one to take care of far-flung areas, especially tribal areas, hill areas, etc. So with the scope of technology, with the possibility of technology helping and providing health facilities to all these people, it assumes great relevance. I will cite an example of radiologists. Radiology, I think the maximum deficit in the medical firmament is of radiologists. And this is one sector where one can remotely serve. The purpose is to interpret the image, diagnose, and report back. So you take the image anywhere, pass it on through IT platform to the radiologist, he will interpret and return. So in Karnataka, it is happening in 20 minutes time. This is just, I'm citing a specific example to highlight the practical part of the digital technology. On the demand side, some of the happenings of the recent past have increased the demand of digital technology. One is that for about 15 to 20 years ago, our focus was to control communicable diseases through vaccination, through preventive health, through community health, etc. So now, as we have been able to control communicable diseases, focus has shifted to non-communicable diseases. Now you'll find that there are Government of India schemes, state government schemes for comprehensive health checkup. Recently, our Honorable Minister conducted biggest in the world health camp about a month ago in Chikbalapur district. So such being the case, you screen lakhs of people at a point of time and you find out they have certain diseases. Now the question is to treat those diseases and handhold them and take care of them for a long period of time. This type of possibilities arise only from the digital sector, and there are a lot of direct and indirect purposes and cost savings if we do it through on the digital platform. So this has also increased the actual requirement in terms of numbers. So the scale has gone up. Earlier there was a demand maybe.
इसकी साइड पे उसमें तो नहीं है.
Earlier perhaps when there are 1 lakh of persons were needing it. Now, because of this enhanced scope and the focus on non-communicable diseases, it has increased manifold. Then another important thing which is helping us in India is the very, very adequate, I mean, very, very satisfactory spread of phones. We have more than 120 crore phone connections, about 75 crore internet connections in this country. Roughly 50% of the people are having smartphones. More than 60 crore people have smartphones. So now the country is ready to adopt and utilize the digital technology in the health sector. So, and biggest thing is, of course, great savings in terms of cost. So if you could have served, say, 100 people in 1 hour, you can serve 1,000 people. There'll be great savings in terms of saving fuel, transportation, shifting of patients, booking prior appointment, etc. So now there are a lot of win-wins in this win-win in this sector. See what has happened in 2020 when COVID came. It has really exploded the use of information technology in health sector. So at that point of time, the technology was adequately developed. So this technology helped us to control COVID in a very substantial manner. And at the same time, because of COVID, the restrictions that were imposed due to the COVID, it has also given an impetus to more and more use of digital technology. This is worth mentioning. So now, as this before 2020, I don't think any such program was hybrid mode. Today itself, roughly 50% people are sitting here, 50% participants are joining online. So this type of thing has become possible only because of, if we can thank COVID for that, we should thank such a nasty disease also. So now, having said so, I will submit before you some of the initiatives that the state of Karnataka has taken. In Karnataka, we started use of information technology quite early. The earliest thing which was used here is the HMIS, medical information system, that is eHospital. That was the first thing to have been used here. In 2015, a pilot project was taken on eHospital in three major hospitals of Bangalore. And in 2017, it got expanded to 47 hospitals. In the third phase, it got extended to 175 hospitals. Earlier, the focus was district hospitals, CHCs, and maternal and child health hospitals. And subsequently, in the fourth phase, all hospitals, CHC and above, all hospitals have been involved. And now it is being taken up at a very large scale. So during the COVID, we realized that there is a lot of problem of interoperability because the private sector was using some of these institutions, were using it quite for some time. The hospital, eHospital, that is hospital management. So now this interoperability, it is being addressed as explained by Mr. Gedam in this program that will go a long way in bringing the private and public players together. Now, another thing that has been focused in Karnataka is telemedicine services. So we started telemedicine services way back in 2008, that time with the help of ISRO. ISRO started helping state in health as well as education quite early during this evolution. So that time, some 24 district level facilities were involved in providing telemedicine services. Then in 2-3 phases, in 2014 and 2019, it got increased to 37 district and taluka level hospitals. And Government of India has come out with this scheme, eSanjeevani, that is online consultation. So a lot of focus was being given during 2020 and 21. We realized that we were trailing behind sometimes during the end of 2020, when we saw the numbers compared to other states. We found that teleconsultation is lesser in Karnataka. So it was unbelievable. Then we found that we were providing teleconsultation through various other mechanisms. 104, that facility was providing teleconsultation in a big way. And apart from that, in 2020, during COVID, we established a lot of centers, multiplicity of centers were there. For example, in Bangalore, there were 5-6 special numbers for teleconsultation. Each district was having, in Bangalore, every ward was having a doctor's team to provide teleconsultation. Then we started consolidating. And within a matter of 3 to 4 months, we became second. So now it was only a matter of consolidation. It was already happening, but it is always advantageous to use single platform and to develop interoperability. So we did that. Now we stand second in the country in terms of the number of tele consultations, and to quote the number, it is 57 lakh, which has happened in the OPD module. So another experiment which is happening in Karnataka is teleradiology. We have selected Bellary district for teleradiology. All the CHCs and taluka level hospitals are connected. The X-rays are being sent to the hub, and more than 7,000 X-rays have been interpreted with the diagnosis of the disease. The overall time taken is about 20 minutes average. So even though, as I have submitted earlier, there is a shortage of radiologists, with that we are able to take the image and interpret in 20 minutes time. Another experiment that we started in 2020 was tele ICU. We realized that COVID requires lung specialists and also management of ICU, especially providing oxygen. So this type of a skill was in deficit. Though we organized at a very large scale, very exhaustive training program with the help of Rajiv Gandhi Health University to train the ICU paramedics as well as doctors, both in public sector as well as private sector. And at that point of time, we trained more than 2-3 lakh of experts in a matter of 2 months' time. There was a continuous drive. There was a studio set up in NIMHANS and Rajiv Gandhi Health University. They trained remotely using this VC, video conferencing, how to operate the ICUs. So going beyond, we realized that deaths were increasing. So our focus was to control deaths in ICUs. At that point of time, we started 2 tele ICU facilities with PPP. One was with Manipal hospitals. Earlier it was Columbia Asia, now it is taken over by Manipal, and otherwise by Narayana hospitals. So there were 2 hubs from where remotely patients were being watched on a regular basis. A specific advice was given, and that helped in bringing down the mortality from 49% to 27% in ICU. This is a very concrete example with a statistics, how use of technology can help the health sector. So having said so, I will only like to submit that this scheme addresses all the deficiency of these previous programs. It also brings together public sector as well as private sector and all the players, the patients, the healthcare providers, the hospitals, and also the industry. And Dr. R.S. Sharma being head, he has taken very good care of the data privacy. And he is very conscious of the fact that how when the bill which is pending comes into being, the data privacy will be safeguarded. So having said so, I will thank the NHA as well as NASSCOM for organizing this program in Bangalore. And thanks all of you for attending this program and giving me an opportunity to speak. Thank you. Jai Hind, Jai Karnataka.